अस्सलाम वालेकुम याकन अब्दु याकन अस्ताइन वेलकम टू माय चैनल डॉक्टर शामी सेज। तो आज की इस वीडियो में मेडिसन 20 फरवरी आफ्टरनून का पेपर मैं करने जा रहा हूँ। सो लेट्स स्टार्ट। आई विल बी स्टार्टिंग इट फ्राम 23 क्योंकि स्टार्ट के कुछ MCQs मिसिंग है। सो क्वेश्चन नंबर 23 सी अनका इज़ पॉजिटिव इन विच ऑफ द फॉलोइंग दैट इज वेस्कुलाइटिस। द फीमेल प्रेजेंटेड विद द कंप्लेंट ऑफ इचिंग, ड्राइनेस ऑफ आइज एंड माउथ, dysphagia, angular fibrosis. Her X-ray shows interstitial fibrosis. The cause is progressive systemic sclerosis, which of the one is different from the plasma in osmolarity, that is the 5% dextrose. Patient brought to ER unconscious. There is a breathing problem. Empty bottle of aspirin found. Which one eliminate aspirin from the body? That is bicarbonate administration. A patient having the retrosternal chest pain, nausea and GERD with velvety esophagus and columnar epithelium. It will increase chance of which of these? The Barrett's esophagus. Cell outlined is preserved in the coagulative necrosis. Next 29, the lady developed DVT after long flight. Test wheel deficient protein C. How long will she need anticoagulant treatment? That is indefinitely. Which of the following factor is involved in eliciting DIC? Tissue thromboplastin. Microscopic feature of the chronic disease of liver and hepatitis C case is the portal and the periportal fibrosis. 70-year-old male with a renal transplant 2 years back, no presented with the complicated pneumonia, not responded to antibiotics. Bronchial lavage shows boat-shaped cyst. The organism causing the condition is the pneumocystis gyrovascular. The patient has the chronic chest pain, regular pulse, and diagnosis atrial fibrillation. He is unable to walk and falls suddenly and can't reach his phone. Emboli from the atrial fibrillation lodge in which artery? That is ACA. Most common acquired thrombotic disorder is the antiphospholipid syndrome. The right shift of oxygen association curve is due to the decreased pH. Most likely for the cortisol is increase after trauma. Common side effect, the potassium sulfate is the hypotension. A young patient blood pressure is 150/95. Serum renin is higher than the normal. Which of the following the stimulus for this increased level of renin is sympathetic stimulation by the renal nerve. Exhaustion of CSF occurs in the recognize granulations. Next 40, the patient with the severe headache, vomiting and the neck stiffness raised ICP on the lumbar puncture. There was blood stained CSF. Diagnosis is the subacnoid hemorrhage which checked when defibrillated. Cause the spasticity, the corticospinal. The patient present in the ER with GCS E4 V3 M5 12/15. Which part of the brain is affected? The temporal lobe. On histology shows flask shaped cells, multiple dendritic synapse in the cerebellar cortex. Patient present with the history of the fever and the jaundice. Which type of the gallstones are present? That is the pigmented. Following paraneoplastic syndrome is associated with the small cell carcinoma of the lung. There is the Cushing syndrome. The patient the sore throat, fever, lymphadenopathy, EBV were detected. He is at the risk of developing the Burkitt's lymphoma, which of the following is locally malignant tumor. There is amyloblastoma. Next, the hyperthyroidism, increased heart rate, the increased sensitivity to the adrenaline, the singer's vocals related to which one of the following? There is a thyroid retinoid. The patient is having restricted movement in the left lateral gaze, inability to close left eyes, and loss of hearing of left side of the lesion. There is a cerebropontine angle. Next, to differentiate between the myasthenia crisis and the cholinergic crisis, which drug is the hydrophonium. In the COPD, diagnosis will be by VQ ratio 0.1. The patient with the enlarged hand and the feet associated joint on MRI mass compressing optic chiasm was found. This is a bitemporal hemianopia. The patient finger cut. Doctor told he is not too worried as he will be fine with the regeneration by the stratum basale. The drug useful in the treatment of an acute attack of migraine after paracetamol ineffective with bisomatriptans. The surgeon nick hepatodental ligament in the surgery from right side. Which structure should be preserved? There is a CBD. The prothrombin time detect following clotting factors, the 1, 2, 5, 7, 10. The following vein open into the right atrium. There is anticardiac when during conversion of the fibrinogen. The fibrin which will detect in the blood. There is a fibrinopeptidase. Early adolescents with a prominent forehead, averted looking eyes, long longitudinal mandible, and the hypogonadism is clinically diagnostic of the Fragile X syndrome. The young thin lean boy with the sign of tetany having the calcium level of 6 and the urine excretion level is 50. What is the cause? That is a vitamin D deficiency. Which of the following is directly related to the coronary artery disease? There is a LDLC. A 50-year-old male diagnosed case of the chronic pancreatitis present with the steatorrhea. This abnormality is caused by the deficiency which lipid digestive enzyme, that is the lipid. Dietary source of the serotonin is tryptophan. The pain of pericarditis is carried by the phrenic nerve. The triceps reflex loss lesion is in the lower cervical. Death due to hanging due to the odontite process of T2. Norepinephrine is released by the postganglion sympathetic nerve fibers. The patient is having history of smoking and has decreased cash exchange. What is the cause? That is the emphysema. In hookworm infestations, the microscopic feature present the peripheral blood slides will be spectacle shaped bilobe nuclei. The acquired immunity is by the antibodies. A patient with a history of the fracture after a while developed the crepitus, foul smelling discharge with the low BP. What is the cause? That is a toxemic shock. The child had the recurrent infections and every time Klebsiella is found. What is the diagnosis? That is the CGD. Next, the character with distinct anthrax bacillus is the anaerobic growth atmosphere. The girl doing exercise that increase the minute ventilation is due to the increased compensate tension, the blood post-influenza infection, the yellow sputum present in the Staph aureus, the patient having the fever, cough, sputum infiltrated in x-rays, gram-positive, catalyst negative, organism isolated the streptococcus pneumoniae. The female in the sterile for 7 years came for tooth extraction. The hyperglycemia she could develop. The patient whose small gut is active to the Crohn's disease present the hyperoxaluria. The cause of this condition is increased oxalate absorption from the gut. Fenestrated capillary is mostly found in the kidney, at which RBC nuclei disappear. The late normoblast duct contraindicating the CLD is the pentazocine. The after mastectomy of the breast carcinoma, female develop wing of the scapula, which is due to the damage of the long thoracic nerve. The part of the pituitary gland, the infundibulum, is called the pars tuberalis. The cremasteric reflux carried by the which nerve? That is genitofemoral nerve. Which layer involved in the esophageal varices? There is a submucosa notch at the lesser curvature of the stomach is the incisura angularis. Structure at the medial side of lesser omentum hepatogastric ligament. The juxin toxicity is caused by the hypomagnesemia. Next, the patient is conscious, admit the ICU, the heart problem, which thing disturbs him most, the anxiety due to what is happening to her or him, whatever. The chi-square test associated with 2x2 table. The patient was given the penicillin. The some infection is allergic to penicillin. What will be found in the blood? There is Ig. The clotting factor sensitized by the liver except the factor VIII. The pregnant lady of the third trimester having unchanged growth hormone. The fisherman presents with the gum swelling and the purpura. Likely cause is the vitamin C deficiency. The patient presents the peripheral tingling, numbness, diplopia, and the visual disturbance. Diagnosed the demyelination disease. What type of nervous system cells affected in this disease? The oligodendrocytes. Next, the patient present with the fever, single dose of which should be given, that is a benzathine, penicillin. The most common infection after the kidney would be the polyoma. Boy have the hemarthrosis, uncle has same problem. This is due to the consumptive coagulopathy, vasculitis that involve the vessel of the different vessel of the different ages. Among these is the pain. The patient went to the process, it did not fit in the mouth, was referred to a doctor examination. He had a rigid tumor. Which nucleus is affected? There is a substantia nigra. The patient has the following SATs. This is the metabolic acidosis. He lost his control by the anterior hypothalamus. The paleospinothalamic tract carried pain by the lamina 2-3 substantial latinosa. To check the status of vitamin A in our community, the most cost-effective method of assessing is the dietary analysis. The vasopressin secretion is increased by decreased pressure in the right atrium. Drug of choice for the travelers. Diarrhea is the diphenoxylate. Disease in which of the neurotransmitter cause the anxiety? GABA. The girl had a bronchial obstruction but alveoli are still aerated due to the alveolar pores. The mean is defined as the sum of all observation variable total observation. Anemic lady with the reticulocyte 10% generous peripheral smear shows small spherocyte. Test for the diagnosis is the RBC survival study. Lower 9 post intercostal artery is the branch of descending aorta. The pregnant lady developed TB taking anti-TB, now developed bilateral VN loss. Which drug is responsible? That is the ethionamide. The cutaneous branches of cervical plexus include the lesser occipital and the greater auricular. The skin cancer most commonly associated with the AIDS is the Kaposi sarcoma. An old man while watching late night movie fell asleep in an armchair sofa. When woke up in the morning, he was unable to grip a glass of water. This is due to the damage of the radial nerve, the Aspergillus and the Staph aureus recurrent infections, but immune disease, that is the NADPH oxidase deficiency, submandibular gland enlargement due to stone in the submandibular duct. What will be the cause of death of cells in the gland? That is the apoptosis. The female present the bilateral pleurophy and the dyspnea with the basal crepitations and the having pedal edema. The most likely diagnosis is the CHF. The during exercise flow is increased by chronic flow is increased by nitric oxide. The patient presented with menorrhagia. Lab shows this is the volubilar disease. The patient having the IgM negative HBS. What is the diagnosis? That is a past exposure. Drug with the maximum bioavailability is the propranolol. The boy with the fever, headache, neck stiffness, Naegleria fowleri. Next common genetic cause of the thrombosis is the homocystinuria. Absorption of CSF occurs in the arachnoid granulation roof of tongue. Taste pathway involves the tractus solitarius. The following neoplastic syndrome is associated with the small cell carcinoma of the lung. There is a Cushing syndrome. The woman had the cause intolerance. What has to be done to know the hypothyroidism? That is the TSH inferiority for the patient. The hypertension and the labs investigation VMA found the urine causes 5 chromocytoma superior thyroid artery is the branch of which of the following artery? That is external carotid artery. Next, the right lung has the bronchogenic carcinoma. Middle lobe removed surgically. Segments include the medial and lateral. The patient after arterial sacral lesion of the spinal cord damage has which effect? There is a neurogenic related lesion at the right optic tract. Result in the left homonymous heminopia. The lady cut her finger by knife while working in the kitchen, which fiber detect the pressure, that is the A beta fibers. The patient presented with the bilateral ptosis, the muscle wasting and mastication, decreased voice until no voice. What a suitable pathology is the Myasthenia gravis, which is the following dietary substance, the carcinogen, and play a role in the carcinoma of the esophagus. The nitrosamines. The patient with the chronic HIV presented with the intestinal obstruction, surgery done, mass loading the intestine. This is related to which of the following? There is a high grade beta cell lymphoma. Next, the cell commonly involved in the graft rejection is the CD8. After third week of gestation, the blood vessels and the cells form type of the villus is the tertiary villus. The patient has frequently regular pulse on examination. Is no P wave, many abrupt R waves, and curious complex regular. What is the disease? That is the atrial fibrillation. Next, the dysradiocognia is due to the lesion of cerebellum. The patient having the resting tremors, shuffling gait in the cog wheel, VTT, what is affected the caudate and the putamen. The malnourished patient developed generalized edema due to hypoalbuminuria. 62-year-old patient with congestive heart failure present the dyspnea and the orthopnea. Mechanism pulmonary edema in the case stage of which of the following? There is the increased hydrostatic pressure. Patient the cough X-ray shows a hilar lymphadenopathy. Non-casating granuloma diagnosis. The psychosis. Non-diabetic female having the chronic granulocystitis develop fungal infection that shows the septate hyphae at acute angle and the producing respiratory symptoms. Most likely there is aspergillus. The kyphosis involve which part of the spinal cord? The thoracic. The diabetic patient present in the OPD with the oozing green discharge. Green discharge is pseudomonas. The patient with the wheezing, nasal congestion in nose and the fever. Biopsy of nasal mucosa shows degranulation of the mast cells. Hereditary spherocytosis. Defective protein is the spectrin. Mother had a history of the hemolytic disease of the newborn, and now she is having 26 weeks of pregnancy. What should be done? That is the mother's serial antibodies. If that space becomes 0, it is called the physiological chance. The 6-year-old girl present the OPD with excessive facial and the chest hairs, adult size, external genitalia, and the deepening of voice. She also gives a history of 2 sibling death suffering from the same condition. Which enzyme deficiency leads to this? There is a 21 hydroxylase deficiency. An old man present with the belching and the discomfort after fatty meal. What should be given? Metoclopramide artery, which supply inferior thyroid gland, is the branch of thyrocervical tongue. After tonsillectomy, the patient develop harshness of voice due to the damage of vagus nerve. The ACE inhibitor is given to the patient. It increases the renin and the bradykinin by the mechanism. Bradykinin increase by the stimulating kallikrein mechanism. Von Willebrand function is the platelet adhesion. Lady pet in the house had exposure to the organism likely to cause the lady, that is a toxoplasmosis. The medial cord, the brachial plexus continues as the ulnar nerve. The part of the pancreas is resected. Whatever the necrosis will be seen. There is a fat necrosis. The bronchial artery rises from which level? There is a T5 T6. Femoral hernia gets strangulated due to neck of sac. The structural posterior medial to the parotid gland is the carotid sheath. The right lymphatic duct is drained into the right brachiocephalic vein. Which of the following is diagnostic criteria for the sarcoma? There is increased vascularity. The VMA is used for the catecholamine secreting tumors. Pregnant lady with a labor pain for the 2 hours and developed dyspnea and the died within 15 minutes of labor. Most likely the cause is the amniotic fluid embolism. With the following translocation is seen: the Burkitt's lymphoma, the 8:14. Newly born child having the suffocation center. Which of the following? There is a distant of the femur. 85-year-old male patient complained of the lower back. Doctor during the examination noticed an outgrown with the tuft of hairs at L5. What is your diagnosis? There is spina bifida occlusa. Common sign oxygen crosses membrane due to the small size. The lady heard his husband saying there is a navel loves. This is the delusional disorder. The patient after posterior thyroidectomy develops harshness of eyes, examination leads to attempts focal, which of the following is the most likely damage? That must be the posterior crico, that is in fact thyroarytenoid. Next, individual was hit on the dorsal surface of the wrist joint. Which tendon might get damaged while passing through the extensor retinaculum? Second compartment, that is extensor carpi radialis longus. Which of the following ligament formed from the ventral mesogastrium? That is a falciform ligament. So that's it. Thanks for watching my video. Do subscribe my channel. Until my next